Hello, and welcome to a digital exhibition of the visual histories of Scottish HIV health promotion. This project is hosted by the Centre for Biomedicine, Self and Society at the University of Edinburgh and curated by Chase Ledeen and Ingrid Young. This exhibition displays a range of health promotion materials created by Scottish health boards and HIV and AIDS charities from the 1980s to the early 2000s. Scotland has a rich and varied history of public health and community responses to AIDS crisis, with a significant presence of health workers across Edinburgh, Glasgow, Dundee, and the Highlands. This exhibition attempts to follow some of the key messages and images circulating during the early AIDS crisis period. The health promotion materials herein encourage safer sex practices and harm reduction during casual substance use, presenting an expansive approach to mitigating HIV transmissions since the 1980s. The materials appear in 4 parts: an introduction and 3 thematic exhibitions. The first, sex and relationships; the second, substance use; and the third, comics and illustrations. Please click through to the provided YouTube links to peruse the selected images and learn more about the visual histories of HIV health promotion in Scotland. Scotland has had 10 notable organisations that have confronted HIV and AIDS crisis in Scotland. The earliest iteration was Scottish AIDS Monitor, commonly called SAM, which was founded in 1983 by the late Derek Ogg, Edward McGough, Nigel Cook, and Simon Taylor. The organisation focused on gay men's health, but also crucially developed health promotion materials and outreach events for injecting substance users, heterosexuals, sex workers, teenagers, and families. The organisation expanded to reach communities in the Highlands, Lothian, Tayside, and Strathclyde, but was inevitably defunded in 1996. Especially prominent was the organisation's Take Care campaign, which incorporated a wide range of social experiences to encourage harm reduction in Scotland. See the Sexual Health and Relationships collection for examples of this health promotion work. Other related and historical HIV healthcare and advocacy organisations, which are now defunct, include Face West, Gay Men's Health, Reach Out Highland, Body Positive, and Glasgow AIDS Carer Support Group. Existing HIV charities, including HIV Scotland, Waverley Care, and Terence Higgins Trust Scotland, have prominent and influential health promotion practices from the 1990s onward. For instance, founded in 1989, Waverley Trust, now called Waverley Care, built the first AIDS hospice in the UK with sites at the Old City Hospital from 1990 and Milestone House from 1991. Waverley Care continues to develop outreach programs for people living with HIV, especially through the Essex Gay and Bisexual Men's Sexual Health Initiative. Their outreach work in the past and present has helped to develop targeted healthcare services for people living with AIDS and encourage realistic approaches to safer sex and community awareness of HIV and other STIs. Established in 1994 as Scottish Voluntary HIV and AIDS Forum, HIV Scotland continues to develop policy and advocacy initiatives for people living with HIV in Scotland. Their work informs legislative changes to healthcare reform and practices in Scotland, and as of 2020, has guided HIV prevention practices in the UK by creating a Scotland-wide at-home HIV testing program. Especially focused on safer substance use, harm reduction, and sexual health, the charity Crew 2000 Scotland was founded in 1992 as a volunteer-led community organisation seeking to reduce harm and stigma associated with stimulant drug and alcohol use. An intersectional approach to substance use, sexual health, family life, and HIV was needed to confront the complex HIV epidemic in Scotland, especially in Glasgow. Crew 2000 has historically developed transparent harm reduction messages and imagery to encourage healthy relationships. See the substance use collection for examples of this health promotion work. Though their materials do not appear in this exhibition, other existing HIV healthcare and advocacy organizations include SHI-VAG and Scot Prep. Scotland has a unique history of using comic illustrations to deliver HIV health promotion, and so the final section in this exhibition highlights some examples of comic strips and illustrations created by Scottish artists to discuss sexual health, injecting substance use, family and relationships, and HIV transmission. These comics were produced by a variety of local artists and commissioned by the Scottish AIDS Monitor and health boards in Lothian, Strathclyde, and Tayside. See the comics collection for examples of this health promotion work. Finally, an image disclaimer. The images on display are provided courtesy of the Lothian Health Services Archive at Edinburgh University Library and the Wellcome Collections and Crew 2000. Every effort has been made to ensure that content displayed in this exhibition does not infringe any person's rights or applicable UK laws. If you believe any content appears illegally herein, please contact the Centre for Biomedicine, Self and Society at the University of Edinburgh via cbss@ed.ac.uk. Thank you and enjoy the exhibition.